It is a widespread condition that is often kept quiet. Around 85% of men over 60 in Germany have a benignly enlarged prostate. In this video, we show you the symptoms and signs that indicate the condition, as well as how it is diagnosed and treated. My name is Holger Gerullis. I am a specialist in urology at the West German Prostate Center in the clinic at the Ring in Cologne. The benign enlargement of the prostate is initially a natural and harmless process and should not be confused with prostate carcinoma. Nevertheless, symptoms caused by a benign enlargement of the prostate, which we refer to as benign prostatic hyperplasia, can significantly impair the quality of life of those affected and also lead to complications. Anyone experiencing symptoms should definitely seek advice from a specialist, because the earlier the enlargement is detected and treated, the fewer complications will occur. The prostate is a chestnut-sized gland in young men located below the urinary bladder and surrounding the urethra. From the age of 35, it can gradually increase in volume. The exact causes are not yet fully understood. Hormonal changes and genetic factors are likely to play a role. In benign prostatic hyperplasia, it is usually the cells of the prostate gland that directly surround the urethra that enlarge. This increasingly constricts the urethra and thus obstructs the outflow of urine. The urinary bladder can no longer empty easily and tries to compensate by building up muscle. Typical symptoms include a weak or interrupted urine stream, a delayed start of bladder emptying, and an unpleasant dribbling after urination. Affected individuals also suffer from the urge to go to the toilet more frequently, often at night. It can lead to a sudden urge to urinate with involuntary leakage of urine, which is particularly distressing for those affected. Often, the urinary bladder can no longer empty properly. Bacteria can then multiply in the remaining residual urine and cause infections. Acutely, it can lead to a blockage of the urethra, resulting in what is known as urinary retention, or with a persistent outflow obstruction, it can also cause a backflow of urine with impairments to kidney function. With the help of a detailed interview, an examination of the prostate, and an ultrasound examination, the condition can be diagnosed. If there is indeed a benign enlargement of the prostate, additional urine flow measurements and ultrasound examinations of the urinary bladder can determine the extent of the outflow obstruction. A urine sample also provides information about already occurred consequences such as inflammations or bleedings of the urinary tract. In the early stages, the symptoms of benign prostatic hyperplasia can sometimes be treated with herbal extracts. If no success can be achieved with these methods, medications are used that relax the muscle cells of the prostate and cause the prostate to shrink. Only when these measures do not alleviate the symptoms, or if there is urinary retention, frequent urinary tract infections, or even impaired kidney function, is surgery the next reasonable step. At the West German Prostate Center, we have state-of-the-art and gentle laser procedures, such as holmium laser enucleation and the diode laser procedure, as well as turris resection and vaporization. Bleeding is reduced by the simultaneous tissue removing and hemostatic effects of the procedures, significantly shortening the hospital stay and healing time. This is particularly beneficial for men with a large prostate and men who are at an increased risk of bleeding due to taking anticoagulant medications. If you would like to learn more about benign prostatic hyperplasia and its treatment options, simply schedule an appointment with us here at the West German Prostate Center in the clinic at the Ring in Cologne. We look forward to seeing you.